Henrico Parents for School Choice. Are we teaching critical thinking in Henrico County Public Schools?
To be clear, all Virginia schools will open for students next year.
The clock is ticking and the bell rings in 8 weeks when Henrico County Public Schools reopens on Tuesday, September 8th.
So, what are we basing our plans on? What's the guidance? The Virginia Department of Education, the Centers for Disease Control and Prevention, and health organizations have provided guidance to schools for reopening.
All of us love kids, and some of us are professional educators up here. None of us are professional doctors, right? And so we're leaning on you guys to really have that expert opinion.
Especially in kids, getting COVID is not really concerning to me.
Doctors and pediatricians, and we hear a number of people refer to the Academy of Pediatricians report.
The AAP strongly advocates that all policy considerations for the coming school year should start with the goal of having students physically present in school. Science should drive decision-making on safely reopening schools. Public health agencies must make recommendations based on evidence, not politics. We should leave it to health experts to tell us when the time is best to open up school buildings.
You're a parent in Henrico County Public Schools?
I'm in Richmond City Schools.
Okay, so if you lived in Henrico County and you've seen our protocols and you know what you know, what option would you choose?
My wife is an educator. She's an elementary school teacher. She, because she teaches largely low-income students, really wanted to be back in schools full-time. For our kids, I think the same thing is true, that I am not really worried. For us, we were very prepared to go back full-time for everybody.
I do know one thing, that our children are in incredible jeopardy if there's not an option for the schools to be open this fall. The safest place for children to be is in the school. We can do this safely. We must do this for our kids.
I'm of the point of view, and I weigh that equation as an individual that has 11 grandchildren, that the greater risk is actually to the nation to keep these schools closed. It is critically important for our public health to open schools this fall.
Given the return to school plan guidance, these are our questions. How would you grade last semester's education? What was the point of the July 14, 2020 school board community meeting? How long had Dr. Cashwell's online for the first 9 presentation, video, and marketing materials been prepared? What about the school board statement? None of us are professional doctors, right? And so, we are leaning on you guys to have the expert opinion. Dr. Danny Evlock, appreciated, but dismissed. Senator Donovan, I do know one thing, that our children are in incredible jeopardy if there is not an option for the schools to be open this fall. Dr. Redfield said that he would absolutely send his school-aged grandchildren back to school in the fall, adding that keeping schools closed would have negative consequences. What about the local, state, and national healthcare organization recommendations? VDOE defers to the CDC. CDC release statement, the importance of reopening America's schools this fall. Joint statement, science should drive decision-making on safely reopening schools. Virginia Department of Health, Phase 3, all students may receive in-person instruction as can be accommodated with strict physical distancing measures in place, which may require alternative schedules that blend in-person and remote learning for some students. Are you asking yourself? If other schools are able to be open for months with no outbreaks, then why not open our public schools? What was the point of the surveys that we were constantly reminded to complete and submit? How are higher education institutions able to open? Should I homeschool? Should I move to Hanover County, where at least I have a choice? Is this what a $500 million plus school budget gets you? I thought this was a local school system. Why is Dr. Cashwell making statements, such as, since mid-June average reported cases? Southeastern states have been seeing significant spikes. What bearing do southeastern states, such as Florida, have on Virginia, much less, locally, in our county? Most important, COVID-19 poses low risks to school-aged children, and children are unlikely to be major drivers of the spread of the virus. What are the short and long-term ramifications? Developmental, social, and emotional trauma, just to name a few. What about the vote? 5-0, fully virtual. As the next clip shows, a gaffe and prepared statements, it was a foregone conclusion as to the outcome of the vote.
Mr. Chairman, I have a motion, if that's okay.
Second.
Oh, I haven't made it yet.